This is Dr. Anderson with North Texas Plastic Surgery, and today we're going to talk about the recovery process from Lipo 360. So just so everybody's on the same page, Lipo 360 is a surgery where I do liposuction that goes all around the torso. I'll always tell a patient that it's from under breast to pubic bone, armpit to hip, and then from your shoulder blade to the top of your butt. My patients always want to ensure that they can do everything they can in their recovery process to get the best results. So I wanted to go through some of those things in the immediate post-op period, the intermediate, and then the more long-term, so that we can have a good understanding of what you can be doing at home, as well as in combination with interactions with the office to ensure that your lipo results are as good as they can be. So immediately after surgery, before you even leave the surgery center, you're going to be placed in a surgical garment. That's going to consist of 2 layers. First, there's an internal layer that we'll call hard foam that velcros in the back, and then over top you'll be in some sort of likely full body garment that is a tighter spandex type thing, so we can get really good compression to hopefully limit the swelling. Now, when I do your surgery, I have to put some fluid in so I can do the liposuction as safely as possible. So you may notice right away you're a little more swollen than you expected to be. That's just part of the process. It'll go away, it'll go down. The other thing that you may notice is bruising anywhere that the liposuction happened. You'll see that those bruises do evolve pretty quickly. The compression helps your body reabsorb that bruise and heal it as soon as possible. So it's going to be important in that immediate post-op period to wear that garment like we talked about in the office at your pre-op visit, round the clock for the first 3 weeks. Additionally, in that period, it's going to be important to drink a lot of fluids, because it may sound counterintuitive, but the more fluid you drink, the better your body processes all the rest of the fluid related to the liposuction procedure. So after you kind of get out of that first 3-week immediate period, you're entering a more intermediate phase where we've seen a lot of the swelling go down, and we may start seeing some of those highlights from the high definition liposuction. In the second 3-week period, I'm also gonna have you in that garment, but instead of wearing it 24 hours, we're gonna cut it down to 12. Now, something patients always ask me in the office is, I feel like the garment's keeping me safe and I'm actually secure in it. Can I wear it longer? Yes, you can absolutely wear it longer than those 12 hours. But if you hate it, it's hot, and it's just too cumbersome for you, it's okay to bounce down to 12 at that point. It's really gonna be important to continue with that good fluid intake. And then also in the intermediate phase, what patients like to ask about is whether or not I recommend lymphatic massages. Now, I think it's okay, even good to do lymphatic massages, but not necessary or mandatory. And we can always talk about that at your follow-up visits if you're somebody who's gonna benefit more or less. I'm very open with communications with my patients, and I'm always happy to go over those things. Now, in the more long-term, kind of after that first 6 weeks, I always tell patients at the 6-week visit, we're not done yet, we're not at final results. Frequently, there'll be a little bit of swelling, residual that's below the belly button, kind of above the pubic bone area, and that's the place that always takes the longest to go away. So I always tell you, don't fret, we're still gonna get better results than we see at that 6 weeks. Final results really take 3 to 6 months. At the 6-week period, we can transition out of garments, although some people are still liking to wear Spanx or yoga pants just to feel a little bit extra there. And finally, the last important thing is having liposuction doesn't substitute all the healthy lifestyle issues that doctors recommend in general. So you're still gonna need to eat a healthy diet and exercise. Those things will just make those results look even better. Don't forget to like, subscribe, and comment below.